Okay, so today's class is on cultural competency, specifically in healthcare. So I'm gonna ask you guys a couple of questions. You can answer too, Kelly. But what are some birthday traditions in your family growing up?
Birthday parties.
Hmm.
Um, birthday parties, and then like lunch or dinner, like that kind of thing, and then
Very good.
taking pictures. Yeah.
Nice. Very nice.
Blowing out candles on a birthday cake.
Mm-hmm. Very good. Okay. Next is how and when does your family celebrate the new year?
By sleeping.
Okay.
Cheersing.
Mhm.
Celebrating.
Staying up till midnight, some families do.
We used to go up to Idlewild every year and get a cabin.
There you go.
Yeah.
Nice.
Especially during what Y2K.
Yeah. Oh yeah. Okay. And then what was a food served in your family growing up that you really didn't like?
Brussels sprouts.
The mushroom soup. Yeah.
Okay.
Meat pie.
Everybody knows this one. Okay. If you wanted to serve a visitor a meal that would help them understand your cultural heritage, what would you serve them?
A meal?
Yep.
Not dessert.
But anything.
Mince pies.
Mince pies? Okay.
Mince pies.
Really? Same?
Yeah. Scottish.
Okay.
Well, no, so they're different. So there's a sweet part, there's a sweet mince pie, and then there's a mince pie.
Oh,
Yeah.
okay.
There you go.
South
Which
Af-
one would you serve?
The sweet one.
Okay.
Yeah, that's from South Africa.
What about you?
Yeah, I just probably make a simple salad
Simple salad?
and some
Here, okay. A simple salad?
some chicken.
Yeah? Is that what you grew up with?
Yes.
Okay,
Yes.
very nice. So we're just asking certain questions about, the last question was, if you had a visitor come to your house, what meal would you make them to kind of describe your culture growing up?
Well, I come from a mixed family.
Mm-hmm.
All the white people in our family know how to cook black food.
Yeah.
Is that a term?
I think so.
I'm like, what's wrong with this picture? White people are in the kitchen cooking collard greens. So I have hosted international students
Mhm.
over the years.
Mm-hmm.
And so they're trying to learn about America and learn English,
Mm-hmm.
but they're also looking to learn about our culture.
Right.
So usually what I would fix for them is barbecue.
Ooh, okay. Very
I
nice.
don't know that that's necessarily, that's just in America,
Yeah.
Yeah.
but I'm not from down south. So it's not like
Well, I mean,
I get
growing
the
up,
Southern food.
yeah, growing up here in Southern California, it's all about Mexican food, right?
Right.
So when I moved to England and I lived with people from Ireland and England,
Mm-hmm.
I made them enchiladas and I did this mild stuff and they were like, my mouth is burning.
Yes.
They don't
Oh.
spice.
Yeah.
Yeah.
Wow.
What about you?
Probably Italian food. That's
Mm.
what I grew up with. And we kind of always cooked. So my mom taught us how to cook. So yeah, probably something Italian. Okay. And then yeah, that was kind of the end of, oh, and then describe a Thanksgiving tradition that you enjoy. So not everybody celebrates Thanksgiving. But did you guys have any specific, traditions that you did on that day? Did you not celebrate it?
Well, there was always the wishbone of the
Okay.
turkey.
To pull it?
Yeah, and I was the oldest grandchild and the only grandchild for the first 9 years.
Oh,
And
wow.
so I got to always pull that with my grandfather every year.
How cool. Very cool.
Poppers, Christmas crackers.
Oh, wow.
Like the,
I know.
yeah.
Is it
Yeah.
both on the side?
Right. One of the biggest traditions is just doing keeping a log of thankfulness.
Mm-hmm. I like that.
Yeah, celebrating Easter and Christmas.
Yeah, very nice. So in front of you guys too, you don't necessarily have to fill this out, but it's just something to think about. This is a diversity wheel. So it's kind of interesting, if you're, with somebody that you don't, oh, thank you, that you don't necessarily know, for them to fill out a couple of things, check mark, maybe, something that describes them. And then you can kind of review each other. So it's like a world event. What happened to you during, your lifetime? You can even do this with your clients as well to kind of get to know them. And then different experiences, family status. So everybody's different. So cultural competency is very important, not just at work, but in your daily life. So you really, it's important to know each other and understand someone's background, because we can be judgmental, judging a book by its cover. We don't necessarily know what somebody has been through. I know when I was working in the hospital, I was taking care of a Chinese man who passed away, and his family wanted to keep him in the hospital bed for hours. And the hospital was like, okay, he's passed away, let's turn over. But they have a whole ritual that they do as like the passing, and everybody prays, and it's really beautiful. And you could see the administrators were just sweating, like, get this man out of here, we need the bed. It's during pandemic time too. So it was like, come on, guys, we need to go. We need this bed for somebody else. And you could tell some of the nurses, some of the doctors, some of the administrators were disrespectful of their culture because they didn't understand it. So it really is important to ask those questions. Not everybody's going to give you their whole lifelong story, but it's important to always just be open-minded, because you don't want to be disrespectful, and you don't want to be, one-sided, right? Because nobody's culture is better than anybody else's. They're all different.
Yep.
That's why there's 31 flavors. Well, there's more than that. Okay, so we're gonna take a look at this very short video, and it's just a little example of cultural competency in healthcare.
My name is Dr. Gerline. We're going to be seeing you today in regards to a diagnosis of iron deficiency anemia. Your primary care has sent you here. We're going to have to run some additional tests to make our diagnosis and confirm it. We're going to need to draw some blood today.
Okay.
Yes, they'll poke you.
Oh, no, no poking. Fasting.
Have you been fasting as well?
Mm-hmm.
Well, that's good that you've been fasting. So we can take you over to the lab here in a moment and get your blood drawn today. Is there a reason why that you can't have a poke?
Oh, Dr. Bird, I forgot to tell you, they doing Ramadan and they do not do any poking, they fast for 30 days.
Okay, Ms. Sharif, so what we could do is when is your period over for Ramadan? What is the date for that?
For 30 days.
30 days from today?
Mhm.
Today you started?
Yes.
Okay, so we'll schedule you back in 30 days to get those labs done.
Okay.
Okay.
Thank you.
Thank you.
Wait, one platform.
That's a good way of getting rid of it quick.
I love how smooth this was.
Yeah,
Yeah,
Not a whole lot of questions, just, oh, okay, when it's done over.
yeah.
no argument.
Right.
It's a very big deal.
Mhm. So there's instances in healthcare where things are more urgent than that. Obviously, that blood test could wait. Let's say somebody comes in and has a major car accident and they need a blood transfusion. There are cultures that don't believe in that.
Right.
And so, you'll see, do you want them to die, or do you want to save their life and, give up your beliefs? You see certain healthcare workers act like that because they're in crisis mode. what you have to do is speak with them, tell them, I understand that this is, this is your beliefs, this is your culture, I'm very respectful of that, but these are the risks involved. So you're just educating somebody in that instance if it is conflicting with, their belief system, but it is something that's medically necessary. And just give them all the information. It's ultimately their decision to make that. But you don't want to. I have seen people go against their belief for the sake of somebody when it's life and death situation, right? So just yeah. Okay, so now we'll get to our literature here. And have you guys ever been in a situation where I think we all have, where you've seen somebody get discriminated against or disrespected for just the way that they look?
Yes.
Okay. All right. How did it make you feel?
Angry.
Upset. Okay. Yep. So we've had a lot of instances recently where coronavirus, you saw a lot of the Asian Americans getting disrespected. I was just getting pedicure and talked with a man the other day, and he said that he was afraid to go outside during the pandemic because he thought he was going to get beaten up. And he said, I feel like wearing a t-shirt that says I'm Japanese. Which he is Japanese. But I said, yeah, but that's not the point. You should never have to identify like that who you are to not have somebody be hateful against you. When 9/11 happened, you watch, the documentaries on that, and a lot of our Muslim community, they did not, those specific people had nothing to do with 9/11. They just, were wearing the hijabs, and especially in New York, you saw they were really fearful of their lives, and people actually were aggressive verbally and visibly towards them.
Right.
So we see it all the time. We see it with our African Americans. We see it in everything. Everybody wants to get mad at each other just based off of the way they look, or now politics or something like that. So everybody's in a bad mood and they're all fighting. So it is really important as human beings that we ask each other, what is your beliefs? What are you, how did you grow up? Because sometimes it's just the way that they grew up. You can't change it. Some people believe in spanking their children. Some people think it's abuse towards their children. We all kind of just have to get to know each other and understand why people are doing certain things.
It's hard when you have a lot of different generations too, because
Big time.
younger generation really likes tattoos,
Mhm.
and then you have the older generation or like Jewish older generation
Yes.
where tattoos are
No,
taboo.
Yep, totally.
Yeah.
Mhm.
So,
Yeah, and specifically with this job, we're
mhm.
dealing a lot with our elderly who have a lot different beliefs on how to do things.
Yeah.
But it can be tough because you have those, fresh new ideas. They do not want to hear it. That's not how they grew up. And a lot of them are from different states too, where things were different that way as well. So yeah. No, it's very important to just be open-minded. Don't be judgmental towards other people, despite their gender, race, religion. The gender is a big one too. Is that sometimes you see men and women just have these power struggles. And some people are really judgmental now that more women are in the workforce than they used to be, or I have a mother-in-law who thinks I shouldn't work. Well, that's how you grew up. Things have changed. So, yep.
Yeah, yeah, we have to try to, if we see indifference in the workplace around town, we have to, treat everyone equally and fairly, even if we don't like it, even if they are rude,
Very much so.
it'll help things go smoother.
Yep. Yeah, definitely. Okay, my friends. So it'll be on your third page after the blank page. Or did you get a blank page? Or probably Kelly took it out. Okay, good. So some learning objectives, we're gonna hear about what cultural competency is, some social determinants of health that impact healthcare delivery, certain myths that are involved with cultural competency, kind of touch base on the different types of areas where cultural competency is important, and how sexual orientation, gender identification, which is a big one in our culture right now, are part of cultural competency, and also how people who are mentally ill or physically challenged can be subject to this as well, and some barriers to cultural competency. And then we'll have a little open discussion. So the definition of cultural competency is defined as the ability to engage knowledgeably with people across certain cultures. So again, the main idea here is to forget about your own culture when you are learning about somebody else. Okay, so that kind of gets rid of the judgment factor here because you're not comparing apples and oranges. You're just saying, hey, tell me all about it. What kind of food do you like? What is your specific belief on this? Do you believe, do you believe in God? Do you believe in the afterlife? What's your religion like? So yeah, certain examples like that. And it is really important. It's kind of hard to do that with your clients just right off the bat. You don't necessarily want to be like, tell me everything about you, day one. But having discussions with them, you can check all these off by just having a casual conversation, right? Even around certain holidays, like what did you do? Like, did you celebrate Christmas? Do you believe in Christmas? What did you do? So that kind of just opens the door. Healthcare, it specifically means providing efficient, current quality care to patients who have a variety of beliefs, cultures, values, and behaviors. So again, there are certain occasions where blood can't be drawn. I also learned that, I think it was Jehovah's Witnesses, they don't take the elevator a certain time of year. It's like a very interesting, yeah. Jehovah's Witnesses have all kinds of little interesting restrictions on what they can have. But yeah, different religions have different stuff they do. And then so anyway, culture can influence how a person understands their symptoms and health status. So there can be obviously language barriers, but also somebody might not have a education in healthcare, or they might not have just a good vocabulary. So they might not understand when you say big words to them.
Or abbreviations like
abbreviations.
PRN.
Yeah, right. So we have to really kind of get a baseline of, do you understand what I'm saying? And I find myself half the time saying, does that make sense? Like at the end of if I describe something to a patient, because it gives them an opportunity to say, actually, I have no idea what you were talking about. Patients' expectations in healthcare, remember, not all certain groups are discriminated against in healthcare. So they are fearful of going to the doctor. A lot of our lesbians and gays and stuff, they kind of have more of an issue going into the doctor and saying, hey, this is what's going on. Women's health, specifically, men's health. Men will not go to the doctor if they have something wrong down there. They just really avoid it until it becomes something serious. So, and women as well. I think women are a little bit more open to it, but it's still, there can be very embarrassing factors. And again, certain cultures, like a lot of our Middle Eastern cultures, it's very taboo what goes on in sexual health. So they don't go to the doctor for it. Not all, but it's just mostly known that way. And also in addition to the patient, who should be involved in making healthcare decisions for them. So some people, they put all of that, role on their husband or their father, or, the man of the house makes the decisions on what my healthcare decisions should be. So really being open-minded to that as well. I saw that a lot in labor and delivery. I would speak to the wife and she'd go, no, he makes the decisions. And I'm like, oh, not in my house. You know, in your head, you say that. You guys, you're not supposed to be judgmental. I'm like, oh, okay. This is gonna be on YouTube, darn it. Okay. And patients' preferences regarding what procedures and treatments are performed on them. So, that's a big one as well. Again, you might see that if somebody has like a breast augmentation and the doctor suggests
Implants?
implants.
Implants.
Find out if that's, you know, gonna piss somebody off, suggesting that before you do. So, yeah, you see all that. You know, sometimes healthcare is an episode of Jerry Springer, and you just want to avoid that at all costs.
Throw a chair across the room.
I've seen it.
Break her all those days.
Yes. Yeah,
I
totally.
just dated myself.
That's right there with you.
So there's a concept called cultural humility. And it's kind of, think of it as an arrow. So you have humility over here, and then on the other end of the arrow is complete open-mindedness. You kind of want to be in the middle. Because obviously being open-minded is very important, but you don't want to go too far that you're now like, oh, I'm getting involved in your culture, and now all of a sudden I'm that way. You know, that's not what people want. They want the openness and the trust that you're not going to judge them, but they don't want you becoming them, right? And sometimes we see that where people try too darn hard, and you're like, actually, you're being disrespectful at this point.
Right.
But humility, it's introduced as a lifelong learning process. So people evolve, people change, cultures change, and generations change. So we want to always be learning about people and what their new struggles are as time goes on, and kind of adapting to those things. I know during like BLM movement, I had no idea what my girlfriend had dealt with as far as judgments on her. And it was like, I'm never gonna know what you dealt with, but I'm open to hearing about it and adapting to understanding. And then making my own, you know, changes in my life about how I approach those things. Because always, you know, you always think prejudice is wrong. It is. But sometimes you don't pick up on those little things that maybe they were coming off as almost a joke, and she was laughing at it, and I was like, oh, she's okay with it. Yeah, no, not necessarily. So, okay, does that make sense?
Yep.
Okay, there you go. All right, as part of reaching cultural humility, healthcare professionals should ask themselves, what part of my identity am I aware of, and which parts are most important? Because more than likely, they're important to somebody else within their own culture. Okay? What biases do I have? Once you know your biases, you can address them. And, you know, have them not come off as judgmental. Not everybody's going to change who they are deep down in their heart. If we could change people's hearts, we'd be billionaires here. But, you know, understanding your own, try to be the best person you can be. And then spread that to other people.
Why we don't talk about politics in our household.
Yeah. And sometimes that's what you have to do, is you have to say, you know what, we're not going to agree on this, we're just not going to talk about it. We're going to avoid that, especially at holidays, right? Because I'd like to get along with you.
Unless you want Jerry Springer
Yeah,
going on.
You want Jerry Springer to come on and say. Okay, what knowledge do I have about other cultures? You might think you know all about Jamaican culture and you know nothing about it. You can Google, you can look things up, you can look up the food, everything. There's always going to be somebody who's from Jamaica who knows a lot more than you. So, but understand what your baseline is so you can learn more, right? How does my sense of identity change based on my surroundings? So that one is kind of interesting as well. Do you change who you are when you're around other people? Right? Are you hanging out with a bunch of Republicans and all of a sudden you're a Trumper, and you go and hang out with your Democrat friends and you're best friends with Kamala. Are you changing who you are? Just something to ask yourself. And then what are my thoughts and feelings when I meet patients from cultures other than my own? Okay, so somebody who combines cultural competency with humility has a knowledge of cognizance. So we want to understand the health-related belief, practices, and cultural values of our patients from diverse backgrounds because it will make us better clinicians, better caregivers, and also to make those suggestions for treatment. So there's certain social determinants of healthcare. I won't read this to you guys and bore you, but there are going to be your patients who are, have lower economic status, right? So what does that mean if somebody is seeking healthcare, but they have a low socioeconomic status?
It shouldn't matter.
No, it shouldn't, but it does.
It does.
Right. Because you do see patients and our clients who do not have good health care, or they are on a crappy plan, even though they're paying a fortune for it still. And they can't get in to see their doctor. And then all of a sudden someone flies in with an expensive PPO and they get to see their doctor right away. Is it fair? No, it's not. And I find myself on the phone half the time saying, well, they're gonna die because they're poor, which is frustrating. And of course we have resources, we don't have enough. And more as our economy is getting worse, we're seeing it where people have such disparities. They don't get in to see their doctor in time for a cancer diagnosis. And guess what? Now they're terminal. But they weren't 4 weeks ago when we could have done the treatment plan. It's not fair. But it is the way it is. I mean, it sucks. Healthcare access and quality. So what if you live out in the boonies and you don't have any hospital near you, or you don't have a doctor's office near you, and you don't have cell reception to get a telemed appointment, right? Education, access, and quality, right? So again, like I was saying, people might not even know how to describe what they're feeling to their doctor. So they come in, I'm in pain. Okay, where are you in pain? Do you feel nauseous? I don't know what nauseous means, or they probably do. But there's certain things that people can't describe to give someone the full picture of how they're feeling to get the treatment that they need, right? And then social community context, some people are really isolated, specifically our elderly. They don't necessarily have or we have a lot of people who come in from other countries too, and they don't know anybody, and they don't have a doctor here. So they're isolated and they're afraid to go to the doctor, right? Because they don't know how Western medicine works. So that's a big one as well. So 1 in 10, I don't know how old, oh no, this is last year, so it's probably pretty accurate. 1 in 10 people live in poverty today. They have inability to afford products, services, including healthy food, healthcare, adequate housing. So think about how expensive the stupid organic avocado is. I mean, the regular avocado is expensive, but the other one's tacked on $3.
Yeah.
But then they expect everybody to, I'm like getting on the soapbox here.
I know. I'm surprised it's only 1 in 10 people.
I am surprised too. That's what I was saying. I don't know if this is accurate anywhere with our con. I'm gonna get shut down on that.
Hello, YouTube.
It's on here though. Okay, the Healthy People of 2030 reported suggestions for enhancing economic stability, and that's increasing access to good quality food, good quality childcare, because that's a big one as well. Our kids are sicker now these days, guys. And enacting legislation that would help people pay for necessities like healthcare, food, housing. I know a lot of schools in this area are now doing during the summer, like free breakfast and lunch for kids, which I think is really important because
During school year too.
yeah, during school year too. Yep. So I think that's super important. Again, this is our country looking at cultural competency, right? We are seeing that people are not all Rockefellers over here. They can't afford food for their kids, and that's not good.
the many mansions and then like
Yeah.
the
mhm.
section housing, yeah.
Yep, yeah, they're building more and more. You are seeing it, the world's not all bad. We are seeing things that are developing that is intended to help these people out. Again, as many resources as we have, we don't have enough because so many people are in trouble financially that they just can't afford to, they barely can afford to survive. Um, Someone was telling me the other day, they said, well, why are people not cooking for themselves anymore? And why, I go, because both parents now, again, generational, both parents are working. So when you grew up, your mom, some moms, had the luxury to stay home and they were cooking and cleaning and they could be there for the kids. They were watching the kids more often, right? Now, mom and dad have to work just to pay the mortgage. So again, we have to understand that and not use our own biases of, well, that's not how I grew up. Well, it's not how it is anymore, unfortunately. Education access and quality. So, again, this is also America's really low on the levels of education. Our kids have been dumber. I don't know how else to describe it. I don't know how else to describe it. Our kids are testing lower and lower.
That happened after COVID or did happen COVID?
It's happened probably since the computer got invented.
Okay.
So honestly,
Believe that.
technology has made us dumber, even though we are much more, we can look anything up and find it out. You would think we would have more knowledge. But if you ask me to do simple math, I'm gonna pull out my phone. Right? You turn off the internet, you turn off all electronics, and people would be wandering, staring at the sky, just walking around, because they wouldn't know what to do. It's just the truth. So yeah, no, our kids are getting dumber. But it also, again, this plays a role in the poverty. So it's harder for people to afford to go to college now, right? We do find that certain cultural groups, people who live in poorer neighborhoods, they don't have as much of an opportunity to go to college because they are in the lower income schools and not necessarily testing well because they probably have a lot of stresses going on at home too, because mom and dad are working and there might be other things going on in the home. And they just don't have that extra attention that's involved for a kid to naturally succeed. Healthcare access and quality, this I think is probably lower, or probably higher, but whatever. An estimated 1 in 10 people do not have health insurance. I would say I think more people don't have health insurance than we think. So being uninsured, it makes it very difficult for people to afford certain medications, services, diagnostics. Try to pay for a CAT scan without insurance. You'll be broke right away.
Try paying for it with insurance.
Yeah, try paying for it with insurance,
That's true.
Again, this is why people are, doing crazy stuff. And going to other countries to get things and procedures and
Then it doesn't always turn out great. And
Right.
they come back and spend more money.
right.
And then there are people coming here
Mm-hmm.
to take advantage of our system,
Mm-hmm.
have procedures done and then go back home.
That's true. Yeah, because it is technically safer to do it here. We have more regulations.
Yeah, they are getting benefits.
Mm-hmm. Yeah, I really will get canceled.
We won't end this.
Okay, so they are trying to provide healthcare at lower cost. Even Obamacare costs a fortune to get. A lot of insurance, even the lowest insurance, is like $380 a month. It's not cheap for people. So again, this can affect how people are treated in healthcare. Also, we have a kind of a strong motto in our healthcare system that if somebody were to come into the hospital and not necessarily have insurance, they go into the ER, they get treated, and then they walk out and never pay their bill, which drives up the prices. But that is good that we do that because we're not expecting our homeless population to just die on the street. They should still deserve that treatment. Neighborhoods and building environments. So there are areas that have not been up to code and they still have lead paint in their homes. There's a higher rate in crime and violence in certain areas of our country. We need to take all of these things into consideration. And then certain states also have, less resources. California, we're pretty fortunate. And our state is pretty picky, so we do have those regulations that some other states just haven't put into effect. The social and community context. So this is interpersonal relationships and social supports that can promote good health. Okay. These are going to be your resources with the Department of Public Health for children and our old people. So there's certain people who do not have family nearby, right? We have social workers that can help with that. We have communities, churches that get involved as well. And then this can affect the dangers and challenges that some of these people who are isolated might face. So you might have a neighbor who says, Mrs. Johnson hasn't come out of her house in a while. Can you guys do a wellness check on her? Police send, they send police, but then a social worker gets involved. All of a sudden, that person, it doesn't happen overnight, but they might have Meals on Wheels that's covered, like you said, Michael. Meals on Wheels that's covered by the government. That person at least has meals coming in. Sometimes they have get them into a state community. So, right. Okay. Myths and assumptions about cultural competency. Someone just needs a cultural competence education program to become culturally competent. Absolutely not. Because you have the most ill culturally competent people taking the things and they learn nothing. So obviously that's not true. It's really something that you have to work on and that you do over your whole life. You never really stop becoming culturally competent. Competence applies to only interactions between racial and ethnic minorities. Absolutely not. This can deal with gender, race, age, physical disabilities as well. That's a big one. People of color are automatically culturally competent. Absolutely not. It goes both ways. Having to learn about cultural competence is yet one more thing I don't have time for. Well, you might not have time for it, but you're not going to give quality care. So if you don't want to learn about, this is America. There's a trillion different types of people out there. So it really is important for you to implement it within your own lives to be the best caregiver, the best nurse, the best person. Because the world's changing and we have to change with it. There's too many cultures in the United States. It's not possible to learn all of them. That might be true, but whoever you come in contact with, you have the opportunity to learn about them.
Yeah, you don't have to learn all about them.
You
You just
don't.
have to be open.
Open, right?
Yeah.
Yep. It's like, I was so in my bubble. I didn't even know there were now I definitely do, but like I didn't know there were certain types of Spanish. I thought there was just one Spanish. And then I learned like a very small part, and I'm like, I have no idea what they're saying. And then my Mexican friend was like, yeah, because that's like from Spain. That's this, Spaniard Spanish. I'm like, oh, wow. So again, who do you know? If someone attends all mandatory legal education programs such as sexual harassment prevention, they already know what they can and can't be done pertaining to cultural competence. That is not true either. Different cultures have different, you might think like I touch Kelly and she might be okay with it, but to do that to somebody who their culture is like a big no-no, you don't touch. Some people don't even believe in making eye contact. That's disrespectful. So yeah, you should learn that. Okay. Discriminatory language and behavior. So we want to always kind of check ourselves first before we say something out loud. My mom used to tell me all the time, say it in your head before you say it out of your mouth. And it's come in handy. I've been in less fights because of it. Because sometimes you are thinking stuff and you blurb it and you go, crud, I said that out loud. So yes, always think about something. You should never be discriminatory against somebody for race, religion, political party, sexual orientation, gender identity. Occupation is a big one as well. I see people, I work with doctors who think they're God, and I'm like, you know nothing. And I've said that before. I've said, you know nothing. That's a stereotype, you guys. Because, yeah, okay, not good. Try not to be disrespectful. Anybody. Race is a really big one. So do not be discriminatory against anybody for what color they are, what culture they come from. We want to be very, very respectful on all levels. Um, and then I just want to point out too, like my brother works LA area as well, and he says, he goes into homes sometimes, and in the predominantly Black neighborhoods, he sees so many sick people. 65% of them do not have primary care physicians, which is really sad. They don't trust healthcare. They don't trust healthcare actually even more since the pandemic. So we're seeing the numbers rise. It is really important if you notice that somebody is fearful of healthcare to maybe give a referral to a doctor that you know is going to be a good fit for them. Because nobody should be not getting healthcare for the color of their skin or feeling like they're being prejudiced against. Ethnicity is a big one. We want to make sure that, we don't group people into one box, okay? Like not all Black people are from Africa. Not all white people are from Kentucky. Or like, you know what I mean? Like, if you have, not everybody's from Mexico. They could be from Spain. We just really want to,
And that happens.
it does happen. It happens all the time.
So,
Mhm.
I learned to ask people, like, oh, where are you from? Which family from?
Mhm.
Try to figure out some sort of way of like, I have no idea what your ethnicity is. Can you please identify it?
Because some people are a really mixed breed. They're like, wow, I've called people mutts before. I'm like, you are a mutt. You are like every damn culture in the world. And they're like, yeah, mutt. Like
Yeah.
you'll live forever, just like those my dogs.
Well, there's this one person I thought they were Hispanic.
Uh-huh.
They were from Iran.
Yeah. Mm-hmm.
Okay.
Yeah.
And then one person I thought was Italian.
Mm-hmm.
And I mean, so now I don't try to guess.
Mm-mm.
Yeah, I feel like if we do it by accident, it's forgiven, but
Yeah.
some people don't forgive.
My favorite was growing up in the Mean Girls movie.
Mm-hmm.
And tell people I'm from Africa, and they would all say that. I'm like, I don't know if you're being serious or if you're kidding at this point,
Yeah.
but it's not okay.
Right.
So yeah, I hated that joke growing up.
Well, and I think sometimes, specifically America, they'll go, well, you're not American because you're, from somewhere else. Well, they were born here or they're American. Okay, just let it go. There's not one box that fits America. Americans are very diverse, and that's what makes our country great, is we have a lot of different inputs and things to take from each other. Okay. Gender identity, sexual orientation, LGBTQ. This is a big one as well. I'm not gonna go through all the types of our, the LGBTQ thing, but they are also very, very, they're not seeking medical treatment like they should. So, and a lot of that comes from a place of embarrassment, and they're feeling like they are getting judged by our medical system. And frankly, they are. You see it all the time where you misgender them, you don't use their correct pronouns. Some people do it on purpose, and it's not okay. We really want to make sure that we're respectful so that these people do come to the doctor. I mean, they can get the flu just like anybody else, so they should be treated. People with intellectual disability, development disability, or physical disability, this kind of speaks for itself, you guys. You don't necessarily see that these people are not wanting to go to the doctor, but they don't get the medical care that they actually need. It is very expensive to be disabled, as you know, our be it not because you're disabled. You just see it all the time with our clients. But to be paralyzed, you better be a flippin' billionaire to afford the care that you actually need. Like our guy. It's very expensive. So we need to also be very respectful of these human beings and try not to say disabled or handicap. I know like times have changed and things that you said before are not how you say it now, and I still find myself saying it because I call it a handicap sticker. It's just what I've called it my whole life. And these people do not like to be called that. They are normal people. And try not to.
Accessible parking. I've never heard that
Yeah.
before.
So they've changed all the signs to say accessible parking.
Oh,
Yeah. Instead of handicap. And intellectual disability instead of mental retardation. A lot of people are really offended by the word retard. It has become a word that is very taboo in our language. So just try to keep those things in mind. It could be really disrespectful and you don't know who's around you. I know I'm with the fire department all the time and they say words and I'm like, you don't realize that someone might be really affected by that word. Listen before you say it in your head first. Is it disrespectful? If so, keep it in your head. And don't say it out loud. All right, senior citizens and older adults as well. We do want to be respectful of these people. Remember, they did come from a different decade, a different generation than you. Try to understand it best you can. Also, like, my mom's like, I don't like being called a boomer. I'm like, well, you are a boomer. But try to not put them in a box as well. They might not be, might not even be in that box. They might have the same kind of, beliefs and things as you. And they've evolved because of us. Right, and the younger generation. Our veterans, this is really, really, really important. So we don't want to make assumptions about our veterans. Some of them have been exposed to a lot of mental illness, or well, they've developed mental illness because of a lot of things that they've been exposed to overseas. We really want to make sure that this demographic is being well taken care of and treated with respect. They deserve it. They put their life on the line. And they're not necessarily coming home the same way as they left. So we do want to be really culturally appropriate with them, be familiar with certain military culture with them as well, because they're like a different species. They have different values than some other people. And yeah, we really want to be cognizant of that and get to know them.
A whole different breed.
They really are.
Yes. Kids who go into the military right after high school, they have responsibilities at 19 and 20
Yep, very disciplined.
that
Yeah.
We don't see in other people who have it.
I mean, you just go on base and it's a whole different world.
right.
Yep.
Now you served, right?
No, I did not, but I have family in the military.
Yeah.
Lots and lots of years of the military.
I just know that my oldest at 20, he said it really kind of rocked him a little bit. That he felt that at 20 years old, if he pushed a certain button, he says World War III was going to start. He says, and that was a lot of responsibility for a 20.
Right.
And people don't realize that these kids in the military, a lot on their shoulders.
It is.
Are you still serving?
No.
Oh, okay.
People with mental illness, this is important because not all caregivers, not all nurses, not all people have mental health training. And they are treating people with different mental illnesses that they don't understand very disrespectfully. specifically like dementia clients. You love working with dementia. I struggle with it sometimes. And it's not, I understand that because there's different levels. Like when they start getting really violent, you get very, you're not getting violent with them too, but you're like, it takes a trained person to deal with that. And if you feel that you can't handle it, get somebody involved who can. So specifically with like our schizophrenics too, like not everybody can handle it. Even autism, there's different levels of autism, and sometimes it's really hard to understand. They're not throwing a tantrum. That's just they're having a moment where they're overstimulated. And so people are like, can you tell? I've heard a lady the other day, can you tell your kid to stop screaming? And she's like, he's cannot help it, you know? So again, check yourself, understand, not everybody can help the things that they're doing, and try to be really respectful of that. Language, we kind of went over it, but don't use the words like fag or retard or things like that. It could be derogatory towards a gay person or yeah. And then certain signs and symbols are also disrespectful. Okay, I also did see this. That thumbs up is now not allowed. It's too it's too aggressive. And it's insulting in areas like Iran, Greece, and Russia. Oh, yeah. I heard this on the news today that the thumbs up is too aggressive, and I use it on a daily basis. Okay. So I guess I'll get that emoji taken off my thing.
I used to wink at people all the time, and I don't do that anymore.
Flirty.
Yeah, exactly.
Yes. Yep. Also, being too nice too. Like I have to warn my husband, do not call the little old lady sweetheart.
Yeah.
Even though you think it's a term of endearment and she's super cute and little and small, just do not use it. You don't know if it's disrespectful. Ethnocentrism. So this is what I was kind of saying to you guys. Don't think that you are better than them. Just because, you have a different race, your race is not the hierarchy. Your religion is not the hierarchy. We do see it with religions too, where they go, well, we're Christian. Well, they're Buddhist. Get over it. We all deserve to be here, and we don't judge. We listen and we don't judge. Right? That's a new thing.
Do you remember that old movie Dodgeball?
Yes.
Better than you, and you know it.
Yeah.
Okay, there are certain cultures that just feel that way.
There are. There definitely
And
are.
you just kind of smile and nod.
Yep.
Smile and wave, Boris, just smile and wave.
Okay, guys, we're almost done. So budgets that limited resources to promote cultural competency. We want to have more interpreters. Okay, not everybody speaks English, and not everything should be written in English. We should provide some pamphlets in whatever language that they have. Cultural competence education, promoting it in schools. I think starting with the kids, learning cultural competency is the best thing. Start them young, go from there. Don't be teaching them later in life when they already have their judgments built into them. Linguistically diverse patients, family material, and diverse staff recruitment programs as well. So I do think that's important too. Like we are seeing more inclusivity in workplace where they're accepting more women into programs where it was primarily men. They're accepting more cultures, more diverse things. So I think we are moving in the right direction. We are seeing it more and more in California than other states. Other states are a little bit far behind in this area of they just are. It's difficult. And honestly, the Europeans are so much better than us because you see a sign, it's in 5 languages. We do not have that. So you wonder why these people coming in from another country are like, where the hell am I? Because it's in English. They don't speak English. They don't read English. And English is a really hard language because if you knew it from the beginning, yeah, but learning it as a second language is a pain in the butt, according to my friends. Okay, developing a culturally competent healthcare environment. We really want to put standards on the cultural competency, modeling it and expecting all of our employees to act in a culturally competent manner. So we set a gold standard for it. Honestly, use the golden rule, treat others as you would want them to treat you, Oh my gosh, my little Lutheran school teacher would be slapping my hand right now because I just butchered it, but it's okay. Culturally diverse staff, we want people from other cultures to be on our staff because then we learn from them. If everybody is the same damn model, we're going to fail. And then monetary resources must be allotted for hiring the entrepreneurs, providing this education. So we need the money to get these programs started. Okay. And then just to touch base with you guys, there's implicit bias and explicit bias, right? So explicit is really saying, like, this is an example, I like whites more than Asians. Not okay. Unaware, somebody who walks in the room, there's an Asian over here, and they go sit farthest point away. Okay. We don't want any bias. We don't, obviously it's more respectful if they just sat over there and said nothing because that person might not even know. But again, it's not healthy that you even have those biases to begin with. So we have seen all of these decline because people have been almost forced to be in groups with each other, which is a good thing. We want that. It's almost like a flooding system where it's like, well, I don't work with all blonde haired, blue eyed people. I wouldn't want to. That'd freak me out. Right? I want to work with somebody from different cultures and things like that. So then you can, and honestly, when you have a potluck, it makes it a lot more fun too. What? I don't want your same dang ham sandwich. Okay, guys. So you don't have a quiz today. The quiz was too much. So you are good.
Thank you, teacher.
You're welcome.
This was really good.
Yeah.
Good. Yeah, I like this topic.